Hi everyone, my name is Jess and I am one of the newest members of the All Care Physiotherapy team, and I have a special interest in women's health, so I figured I would kickstart my tip of the week videos to be women's health based. And the number one thing that comes to mind when people think of women's health physiotherapy is the pelvic floor. So today I thought I would make my tip of the week video to be tips of what not to do in order to do a better pelvic floor contraction. So tip number one, and something we see a lot of, is people think that a pelvic floor contraction is squeezing their bottom muscles as tight as they possibly can and thinking that that is squeezing all those muscles in the downstairs region. But that is not true. You're just squeezing your bottom muscles. So try not to squeeze those muscles at all when you're doing a proper pelvic floor muscle contraction, as well as the muscles on your inner thighs and your legs. If you feel like your legs are tensing up and you can feel your muscles squeezing in your legs, that is also not a proper pelvic floor muscle contraction. And the last tip I have is holding your breath. So if you're concentrating so hard and you're trying to squeeze your pelvic floor, you find you're holding your breath, and sometimes you're even sort of bearing down or pushing down, you're holding your breath that much, that is definitely not a pelvic floor muscle contraction. So those three things are what we want you to try and avoid. We want you to be thinking about the muscles underneath that region, gently squeezing together and lifting up. So if you think that you've been doing your pelvic floor exercises wrong this whole time, make sure that you book in to see a women's health physiotherapist and correct your technique so you have a stronger pelvic floor.